My name is Brenda Caraveo.
My name is Gus Calvillo.
My name is Wendy Chow.
And I'm Carissa Concepcion.
And today we're going to be talking about pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia.
Those affected by pneumonia are infants and young children, especially those younger than age 2, because their immune system is still developing. And also people older than 65, and also people that have underlying health problems such as weakened immune systems. Approximately 1/3 of the pneumonia cases in the United States each year are caused by respiratory viruses. These viruses are the most common cause of pneumonia in children younger than 5 years old. Anyone can get pneumonia, but some people are at higher risk than others to get pneumonia. An estimated 156 million new cases of pneumonia occur each year, 97% of them in the developing world, and 7 to 13% of them severe enough to require hospitalization. 74% of those cases occur in just 15 countries, mostly in Asia and sub-Saharan Africa, with 43 million cases in India alone. And it can also be acquired in the hospital. You're probably wondering why it's important to know about pneumonia. Here in the HBU community, it's important to know because we are in close quarters in class and in dorms. And there's also various elderly communities in the area of Southwest that are right outside of HBU that also are at high risk for acquiring pneumonia. And right around the corner we have Memorial Hermann Southwest, who may have elderly, infants, and children and chronically ill patients that are at high risk for pneumonia.
Hi, Miss Carissa, how are you doing today?
I don't feel very good.
What's wrong?
I think I have a fever and I'm really tired and my muscles hurt all over and I have a really bad headache.
Okay, I see you're coughing as well. Do you feel short of breath at all or anything?
Yeah.
Okay, you do? Okay. I'm gonna go ahead and take your temperature. Oh, okay. Your temperature is lower than normal body temperature, so I think you might have pneumonia with all the signs and symptoms that you're having. Certain chronic diseases such as asthma, COPD, and heart disease can place a person at risk for developing pneumonia. People with weakened immune systems such as people with HIV or AIDS, organ transplants, people on chemotherapy for cancer, or long-term steroid use can be at risk for developing pneumonia. Other risk factors include smoking and being placed on a ventilator can also increase someone's chance of developing pneumonia.
Pneumonia can be hard to diagnose because the signs and symptoms are similar to that of the flu. It may not be recognized until symptoms have gotten worse. The doctor will diagnose pneumonia based on the patient's medical history, a physical exam, and diagnostic test results. During the medical history, the doctor may ask the patient about their recent exposure to people with pneumonia or other respiratory illnesses such as tuberculosis, their history of smoking, occupational risks, recent or chronic respiratory infections, recent antibiotic therapy, recent outpatient wound care, home infusion therapy or dialysis, recent travel, or exposure to birds, bats, and other animals. During the physical examination, the doctor will listen to the patient's lungs with a stethoscope. If the patient has pneumonia, their lungs may make crackling, bubbling, and rumbling sounds when they inhale. The doctor may also hear wheezing during exhalation. your doctor thinks you have pneumonia, he or she may recommend one or more of the following diagnostic tests. A chest x-ray can be used to confirm the presence of pneumonia and determine the extent and location of the infection. A blood test is used to find out whether the infection has spread to your bloodstreams. A pulse oximetry is used to estimate how much oxygen is in your blood. A sputum test may help determine what germ is causing your pneumonia. Pleural fluid culture is used to analyze and determine the type of infection. If your pneumonia isn't clearing as quickly as expected, your doctor may recommend a chest CT scan to obtain a more detailed image of your lungs. Treatment for pneumonia primarily involves curing the infection and preventing any complications. These include antibiotics used to treat bacterial pneumonia, antiviral medications used to treat viral pneumonia. Fever reducers such as aspirin or ibuprofen are used to manage fever, aches, and pains. Cough medicine are used to suppress cough so that the patient may rest, but because coughing helps loosen and move fluid from the lungs, it's a good idea not to eliminate the cough completely. The patient should rest and drink plenty of fluids to help loosen secretions and to bring up phlegm. If the pneumonia becomes so severe and the patient is needed to be treated in the hospital, they may receive fluids and antibiotics through the veins, oxygen therapy, and possibly breathing treatments. There are several ways to prevent pneumonia. Getting the flu vaccine each year as well as the pneumonia vaccine can reduce the risk of contracting or spreading pneumonia. Good hand hygiene protects against ordinary respiratory infections that sometimes lead to pneumonia. Wash your hands regularly or use an alcohol-based hand sanitizer. Stop smoking, because smoking damages the lungs' natural abilities to filter out germs and defend against respiratory infections. Keep your immune system strong. You should get plenty of rest and exercise regularly. Eat a balanced diet full of fruits and vegetables. Increase your fluid intake because fluid will keep you hydrated and can help loosen the mucus in the lungs. Limit contact with people who are sick because being around people who are sick increases your risk of catching what they have.
If you have pneumonia, it can affect you physically, emotionally, and mentally. Physically, it can take a toll on your body, so you want to make sure you get adequate rest. Emotionally, it can cause anxiety or fear, so don't be afraid to seek help because pneumonia is one of the most solvable problems in global health. Mentally, it can take a toll on your body because it may cause sudden changes in mental awareness. In terms of spiritual or emotional support, there are support groups and emotional support that's available for you to help you make lifestyle changes as well as connect with others who are going through similar situations. In addition, there are online support forums that are available, which are free and convenient that you can access at your very own home. In addition, there's a group called the Global Coalition Against Child Pneumonia, and this is the group that helps raise awareness to protect against it, to prevent and to treat pneumonia. In addition, they've declared November 12th as being World Pneumonia Day. And in terms of rehabilitation, full biological recovery after pneumonia takes about 6 to 12 months. In terms of rehab programs, you may have to deal with physical therapy, respiratory therapy, and antibiotics to treat your pneumonia. In conclusion, these rehabilitation programs and support groups will help to prevent future instances as well as to promote improved health.